Hi, and welcome to Inside View. I'm your host, Joel Metzger, and joining me on the show today is Dr. Randy Smart. He's a board-certified internist with a practice in Murphy's and also the chair of medicine for Mark Twain Medical Center. Randy, welcome.
Thanks, Joel. Great to be back.
Hey, it's good to have you on the show. We are continuing a series of topics that we really feel are going to be helpful to the public. And the one that we're going to talk about today is especially appropriate because of the season that we're in right now. We're going to talk about hay fever. But I wanted to ask you, where does the name hay fever come from? And is it really the right name for these conditions?
So, great question. Hay fever came about because the people that worked in the hay fields would get this problem, and it could get serious enough that it just seemed like a fever and a crisis. And so it got the colloquial term hay fever, and that's how people often refer to it. The real name for this is allergic rhinitis. I believe, Greek name for your nose is rhino, like rhinoceros. And so allergic rhinitis means your nose is allergic to something and it's causing you problems.
So the whole hay fever was really kind of a misnomer because it happened around that time of year when the hay is being harvested, and it felt like a fever, but really neither of those are to blame.
Absolutely correct.
Interesting. So what is this condition, this affliction, and it seems to impact a lot of people. So is this a pretty serious thing?
So it really is. This time of year, every doctor's office in Northern California is dealing with this every day, and in particular Calaveras County. And what we know is this hay fever, allergic rhinitis, affects at least 30% of the population. In Calaveras County, that would be 15,000 people. And we know that economically the burden is huge, not just with missed work, but the actual money spent on hay fever is on the order of $11 billion a year. That's for medications, appointments, interventions. So it's got a big economic burden. It's all over the county and Northern California. I would guess that most people with this don't seek medical attention. Probably over 50% never see a doctor. And I would guess many people that have this probably don't understand that they have it. They probably aren't really aware of what they have and what to do about it. And some of the information you and I can share today is to tell the audience what these symptoms are, how they can recognize it, and maybe what they can do about it.
There's no reason to suffer through this condition and do nothing but suffer. You actually have a lot of tools at your disposal which could make a big difference, right?
Right. The hay fever is not a fatal disease. That would be very unusual. It's just a very annoying and disruptive disease. So not treating it isn't a critical or fatal mistake. But there is absolutely no reason to suffer with this. And some of the patients are absolutely miserable. Some of the kids miss school. People miss work. And we see people every day, including today in my office, that come in and say, I really need to do something about this. This is driving me crazy.
Why do you think so many people aren't seeking medical attention for this or trying to treat it in some way? Is there a social stigma around seeking medical attention for this?
Well, I don't know. I don't know the answer to that. I mean, sometimes people don't have medical insurance. Sometimes people don't have time for medical appointments. Sometimes people don't have money for medical appointments. But many people, I believe, actually tough it out. You know, if your leg hurts, you tough it out. You know, if you got a nosebleed, you tough it out for a couple days, and that's what we're made of, and I think that's what people do. But I think there could be a lot of reasons they don't seek medical attention. One of them is Calaveras County doesn't have a lot of medical doctors. I mean, we are designated as a county that has it's a federal designation that we have a shortage of doctors, and we really need more.
Got it. Let's get into what hay fever is and why it impacts the body the way it does.
So it's all about this stuff. It's about your face and your rhino, and so your nose is connected with sinuses, which are air pockets. Your nose is also connected with your eyes. There's a tube that goes from your nose to your eyes. Most people don't know that. Mm-mm. There's another tube that goes from your nose to your throat. So all this stuff is connected. The nose has a huge amount of sensitive tissue in it. And what the nose is designed to do is detect bad things, invaders, infections. And so there are cells that specialize in doing that. And when certain what we would call allergens enter the nose gets activated. Now, the best example I can think of is not hay, but is pollen, and which is what we're starting to see right now, the pollen from the trees. And we can talk about the seasons, and but that granule of pollen that you can't even see. It's in the wind, or it's on a dry day. A hot day, that granule of pollen gets into your nose, and the cell goes, uh-oh, something's wrong. It starts releasing chemical, what we would call messengers. And those chemical messengers cause the nose to start swelling. It gets inflamed, it starts to swell, it starts to drip, so people will have a runny nose, they'll sniff. It'll cause the drip to go backwards and to go into the throat. It'll cause people to cough. It'll swell to the point where people can't breathe. They can't breathe at night. They can't breathe during the day. They breathe through their mouth, unless they find another way to breathe. That activation and inflammation can go back into the sinus tissues and cause sinus problems. It can go up into the eyes, cause tearing, cause itchy eyes, cause blurry vision. And ultimately, that inflammation can get down into the airways and cause what we call allergic bronchitis, which is coughing, and it ultimately cause a disorder we refer to as asthma. And asthma is when all these lung airways become inflamed, hyperreactive, squeezing, and because of that, the patient starts wheezing, is short of breath, and ultimately ends up in the hands of medical people.
And this is toward the more extreme cases. Most people are mainly dealing with like inflamed nose, coughs, just general discomfort.
Right. Most people with allergic rhinitis sneeze, sniffle, have maybe a little bit of trouble breathing, usually not much, some. The sneezing can lead to irritation. The irritation leads to nosebleeds, so it's not uncommon to have nosebleeds. And some will cough a little bit, some will have itchy eyes, but it actually can seem very much like you're getting a cold.
How would one differentiate between cold symptoms and these symptoms?
It can be difficult. They can be very similar. The allergic rhinitis tends to be very seasonal and tends to be recurring. So the patients that get it tend to get it 2 times a year. They get it in the spring, like April, May. And then in California, it's got another peak around September, October, and we could talk about why that is. But the patients tend to be recurring. It tends to be seasonal. But let's say it's the first time you got it. You don't know if it's seasonal or not or recurring, and so there are things that go more with a viral cold. That would be headaches, body aches, a malaise, a feeling bad, they can be very similar. But generally, the cold is more recognizable with the headaches, the body aches, sometimes fever, and the allergy is more the sneezing, the dripping.
If I blew my nose with a cold, would I have more of a mucousy look versus if I had allergies? Is it more of a clear drip or?
Not necessarily.
Okay.
The cold patient can have clear nasal discharge. Now, as that discharge becomes more opaque or yellow or brown, that's more indicative of infection versus allergies. That can get a little tricky because people that get allergies can ultimately get infections. Now, that's not a cold, that's infectious sinusitis. But just having the clear discharge doesn't really separate one from the other.
Body ache is more of a clear sign, a general malaise feeling.
Maybe fever.
And fever.
Headache.
Okay.
The people that get headaches are more likely to have a viral infection and a cold. But sometimes it can be a really tough call. Even for the medical people, we can look at somebody and say, man, I'm just not sure. I think she's got allergies, but maybe not.
So if you identify these symptoms and you believe that, man, this might be allergies, and it's really uncomfortable, not something you want to tough out, is it time to seek an over-the-counter remedy, or is it time to go see your doctor?
Right, so I think there are a lot of things allergy patients can do prior to the doctor's appointment. Now, it never hurts to consult with a doctor. And if there's any confusion or uncertainty, that's certainly the right thing to do. But if you have the symptoms of sneezing, some discharge, itchy eyes, and you're pretty convinced you have allergies, you can do this without a whole lot of medical care and without a lot of expense. For one, you might ask, well, if I go to a doctor, are they going to order a bunch of tests? You know, is there an allergy test? Well, on an initial appointment for the average patient, it's all based on history and physical. So there isn't a blood test really or an X-ray really that we use in that scenario. And so the patient can actually make their own diagnosis, and many patients do. They'll come in and say, hey, I've got allergies, I need help. But once they make that determination, there are things they can do. One of the more important things they can do is called avoidance. And you want to kind of try to avoid the thing that is irritating your nose and causing the allergy. Now, you might think, well, how am I going to avoid pollen? You know, so for those patients that are allergic to pollen and trees and grass, there are things they can do. They can keep some of the plants and the flowers out of the house. That can help a lot. It's amazing to me how many allergy patients have a big bouquet of flowers in the house. Get them out of the house, buy plastic flowers. You can close the windows. Particularly the bedroom windows, the room you sleep in. So if you close those windows, that can help a lot. And then you can get filters for your HVAC, for your air conditioning and your heating that are a little higher grade filters. I believe they're called HEPA filters. Mm-hmm. And they're not really a lot more expensive. You're talking dollars, not hundreds of dollars. Putting the filters on, closing the windows, getting the flowers out of the house will help. Many allergy patients will develop a hypersensitivity. Once they start this allergy thing, they start reacting to other things like smoke, perfume, virtually anything you can smell. And you can get those things out of the house. I mean, once you have a family discussion. So for the seasonal patients, that's what we would recommend. Now, there is a kind of allergy called perennial allergies. It's not seasonal. It's not just the spring and again in the fall. It's all year long. And we think those patients are reacting to things more in the house. And that would include animal dander, like cats and dogs, birds. That would include dust mites, dust itself, smoke. And so they become hypersensitive to those things. Sometimes we try to recommend things they can do in the house, like maybe having a room the cat doesn't go into, like the bedroom would be a good example of that. We can't really get people to get rid of their cats. They won't do that. They would rather have allergies. But they can leave the cat in part of the house and not let the cat in the bedroom and keep the bedroom a little cleaner than you might. No cat hair, cat dander. So those kinds of things with perennial allergies, and maybe if you're the allergy patient, maybe you shouldn't be cleaning the house.
You're stirring everything up.
Because you're breathing all this stuff. Maybe it should be somebody else in the family, or maybe you should hire somebody. So avoidance helps. It helps a lot. I had a patient years ago who we put in the hospital at least once a month, and we did that for 3 years. And I kept talking to her about her cat. Her name was Shirley, and I said, Shirley, you have to get rid of this cat. She said, I'm not doing it. Went around and around. Finally, Shirley disappeared. Didn't see her for a year, and she came back. I said, what happened to you? She goes, I got rid of the cat. I don't need to be hospitalized anymore. I don't even need any medication anymore. Cats are the most allergenic animal we know of.
Very interesting.
And cats are great. Cats in my life, but they can cause a lot of misery in terms of allergies. So avoidance is number one. There are other things patients can do that are both good and bad. And I brought some samples of things I just bought at a drugstore 15 minutes ago. And there are two different things here. One is called Afrin, and the other is called Rhinocort. Rhino, nose, right? Yeah. And so one of these can be very helpful to patients with allergies, and one can be very harmful. They're both over the counter. They're both inexpensive. So what we think works the best is nasal steroid sprays. There isn't an allergist in the country that would disagree with that. And in the drugstore today, I didn't bring all three, but there are three that are easily purchased over the counter, no prescriptions. This one's Rhinocort. There was another one called Nasonex. The one I like in particular is called Flonase. You can buy it for a couple bucks. It's not harmful. It's not addictive. It works, and it works really well, and you simply need to spray and sniff it back, and you could do that once a day and really change your life.
Is that going to be effective for pollen and dander and dust, or only pollen?
It would be effective in most patients. Now, there are some exceptions. There are some allergy patients that don't respond to this, but probably 90% of patients will respond to this, whether they have the perennial allergies like the animal dander, dust, or the pollen and the grass and the trees.
So it's working for both. So I think we need to dig further into what's going on when these little things like pollen or dander hit your nose. These aren't harmful things.
No.
But your body thinks they are.
Exactly.
Why? Why does your body think these are so bad?
Well, your immune system is a very powerful system. It is your best friend, usually. But it can be hypersensitive. And we don't understand why people get hypersensitive to these. We know there are some risk factors. We know that children that have smoking mothers have more allergies. We know that children that are on antibiotics early in life have more allergies. Interesting, people in urban centers have more allergies than those of us out in the trees and the weeds. I'm not sure why that is, but there seem to be risk factors. We don't know why. There is a specialized cell in the nose called a mast cell, M-A-S-T, mast cell. And that cell is very sensitive, and something sticks to it and it doesn't like it, and it calls out everything. It says, okay, this is bad, let's go get it. And it could be a piece of pollen rather than a virus or a bacteria or something dangerous. Why our immune systems are so hypersensitive, I don't think we really understand that.
Okay, so we don't know why the body is kind of misidentifying these harmless things as something that does need to be killed. But once that happens, what do these drugs do to somehow prevent this big response by the body, which is so miserable?
Well, this drug is a drug I think causes more harm than good.
Okay.
And this particular drug is called a vasoconstrictor. So if you have a plugged nose and you can't breathe that well and you have allergies, and you buy this, and a lot of people buy this, and you spray it in your nose, it opens wide open, and man, you can breathe again, you can sleep again, you can go to work again. Well, how great is that?
Sounds great.
Great. So what happens the next day? You use it again because it feels great. Well, if you do that for 5 days and you keep doing it, the minute you stop, you have what we call rebound edema. Your nose swells up so tight you can't breathe at all. So what do?
Use it again.
You use it again. I saw a patient last week who is a truck driver in Calaveras, and he's been using this probably every day of his life. I know every day of his life for the last 20 years. And he can't get off it. He has a bottle in his pocket. He has a bottle in the truck, has a bottle at home. And if you see an allergy patient and you ask them, do you have any of this around? They pull it out of their pocket and say, yeah, right here. Otherwise, I can't breathe. So that's called rebound edema, and it's a really hard thing to treat. It's not the patient's fault. They don't know any better. They're just trying to breathe. But no, I don't believe this should be over the counter. I think it should be by prescription only.
While we're on that, what is the harm of using it every day? Is there long-term harm, like that truck driver who used it for 20 years? He's breathing every day. He's using this every day. What's the long-term negative impact?
You'll do it for the rest of your life. It'll never, ever get better. With this, we can make you better. With some of the other medical therapy, we can get you to the point where you don't need much spray. With this, you don't take a vacation unless you have like 3 bottles of this. You don't get on an airplane unless you have this. I mean, it's in a way addictive.
It sounds like it's an addictive thing, even though it may not be working in the same way that like heroin has you addicted. You want to breathe, and so you use this every day.
Right. And it's not so much that it's harmful. I mean, there are some concerns about raising blood pressure. It's just that it's a trap that the patient could avoid and do so much better if they did avoid it.
So tell me how the other one works.
Right. So the nasal steroids are really the first-line therapy we use, and there's a second and a third-line therapy. But what the steroids do is they calm down that mast cell, the mast cell that calls in all the troops. So the nasal steroids go in and they say, wait a minute, it's okay. It's an immune modulator. And the audience needs to know that there are many types of steroids. There's androgenic steroids that the bodybuilders use, that the Olympic Committee looks for. That's not what this is. There's glucocorticoid steroids that are a little bit challenging to use and should only be used by specialists. That's really not what these are. So these are safe, they're not addictive, they're not harmful, and they calm down these mast cells. Now, they don't work all the time, but they work a lot of time. And some patients will use this in April and May. The summer's great, and then they may start up again in September, October, and they do absolutely fine.
Are you putting yourself at risk if you're calming this mast cell down to where it's not going to recognize a real threat?
Not as far as we know. Your immune system is very powerful and is not too easy to fool. And as far as we know, no.
So this is
you don't do that.
Just toning down that hypersensitivity to not react to these harmless things, but allowing it to continue to protect you from the harmful things.
Exactly.
What a great solution. Wow.
Great solution. Costs a couple bucks.
Okay.
I mean, very easy to use. Now, there are some other things allergy patients can use. I didn't bring those with me. But some of these chemical mediators are histamines. And histamines are very powerful mediators, and so there are medicines we have that are antihistamines. And these antihistamines can be very helpful for these patients. There are many of them. Good examples would be medicines like Zyrtec. Another one would be Claritin, which is also known as Loratadine. These are all over the counter. And those are pills you take, but it calms down your entire immune system. So if there are problems with itchy skin because of your allergies, or problems with your eyes because of your allergies, or problems with your ears, and you need something more than a nose spray, you could take an antihistamine like Zyrtec or Claritin. And another one would be called fexofenadine. I think it used to be called Allegra. And they can do wonders for you.
Can you ever combine multiple treatments for the best result?
Absolutely. We do that in the office all the time. And the patient is okay doing that. The patient could add a nasal steroid and take Claritin, and that would be perfectly fine.
We have 2 minutes, Randy. Is there anything else that we really need to let the viewers know?
Well, probably the time they need to go to the doctor is if they're not sure what's wrong, they probably should go see the doctor. You don't need an allergist. Any primary care doctor does this all day long. Family medicine, nurse practitioners, internists, they all do it all day long. So any doctor will work. You don't need an allergist. The other time is if there's any signs of infection. And people with allergies, we mentioned this earlier, can get sinus infections. So if you start to have facial pain and you start to have fever, you should probably see somebody, because a sinus infection is a whole different ballgame, can be serious, and can potentially be life-threatening.
Okay. Well, I hope we've given people some basic information to get some relief if that's the road they want to take. And hopefully they'll take advantage of these tips.
I hope so, Joel. Thank you so much.
Thank you. And thank you for joining me on this edition of Inside View. I'm your host, Joel Metzger, and I hope you join us next time.